Welcome to 22 and 23. Today's topic is male puberty. So to clarify, we're talking about the puberty timeline for those born with male anatomy. So first, when do we expect things to start happening? Normal puberty can start anywhere between 9 to 13 years old. So it's really a spectrum. And the first sign of puberty is going to be testicle enlargement, which is pretty hard for someone to determine. The changes are slight, and it's really not something that, puberty started today. It's a slow process. So again, puberty, the average range is going to be between 9 and 13 years old, although the average time that someone with male anatomy starts puberty is around the age of 11 and a half. So that's when the testicles will start to enlarge. And that happens over the course of the next 3 to 4 years. So 11 and a half to 15. The next things to happen are going to be a little bit of pubic hair developing and a little penis growth. Again, all of these things are going to be barely noticeable at first. You might notice a couple of pubic hairs, which are going to be darker hairs in the private area around the base of the penis. And then the penis itself will slowly start to get bigger. Again, this is going to be over the course of many years. So don't panic if you don't wake up one day and bam, things are larger. It takes a long time. The next thing to happen is going to be the growth spurt. So that usually happens about 2 years into puberty, or if puberty on average starts around 11 and a half, then you're going to get the growth spurt around 13 and a half. Keep in mind, you're going to slowly be growing over the course of that time, but then we call it a spurt because slow, bam, grow a lot, and then still keep growing a little bit more. So even after the growth spurt, don't panic. It's still possible to grow a little bit more. And then one of the last events of puberty that you probably will not notice is that sperm count increases. So in ejaculate, there will start to be more sperm. And that's a reflection of those testicles really kicking into gear. And then puberty's done. A couple of things that you may have noticed that I didn't mention. So one, how about facial hair? Facial hair usually doesn't come until years after puberty. And that's because the testosterone that's required for facial hair to develop is produced by the testicles, and it's a slow increase. And so you wouldn't expect the facial hair really to be a part of it until later anyway. Another thing that comes a little bit later is going to be the voice drop. You certainly might notice some squeaks and cracks during puberty, and some people do have a more adult-like voice toward the end of puberty, but that's also one that takes a few years after puberty. And the last thing is muscle bulk. So you will get your growth spurt during puberty, but after puberty is really when you can expect to start putting on that muscle mass. And so if you are a competitive athlete and puberty started a little bit later for you and you're really trying to weight train or keep up with some of your peers, keep in mind that your muscle mass comes in after puberty, and you might just have to finish puberty until you can really start putting on that muscle. So I know it's tough, but it's just one of those natural things that the body has to go through. So let's talk about testicle variants. Again, first thing to start growing, slow growth over a long period of time. You should have 2 testicles. So you should be able to feel 2 testicles within your scrotum or the ball sack. If you don't feel 2, talk to your doctor. It is normal for one to hang a little bit lower than the other. It's also normal for one to be a little bit larger than the other. If you notice significant differences in sizes, then you should talk to your doctor. Otherwise, the testicles should feel nice and smooth, except for maybe a little bump on the back side of the testicle toward the top, and that's where all of the vessels and nerves connect to the testicle itself. And then pain. If you ever experience any significant pain in the testicles, it's usually worth a trip to the emergency room. I'm not going to talk about that in detail here, but pain in the testicles is usually an emergency. Now, penis variants. So normal events of puberty are going to be those random boners or erections that you get throughout the day. It happens. Carry a book with you or a backpack or something that you can hang out in front of you if you get embarrassed, but it's super normal. Also, wearing maybe tighter boxer briefs or briefs can keep the penis closer to the body in case you experience these a lot. And then a couple of things that happen to the penis during the nighttime that pick up during puberty that are super normal are morning wood, or we call that nocturnal penile tumescence. So when you have an erection in the middle of the night or wake up in the morning, and that's actually something that happens a few times a night. So it happens during REM cycle of sleep, so one of the normal phases of sleep, and we know that it's common to get multiple boners a night. So nothing to feel embarrassed about. It's super normal, super common during puberty. The other thing that might happen is when you have an erection with sleep, it might rub against the sheets and cause ejaculation. This is otherwise known as like a wet dream or a nocturnal emission. And it's also very normal. It can feel a little embarrassing, or you might have to wash the sheets, but it's really not a big deal. It's a super, super common part of puberty and just a sign that everything is going well. If you don't get those, also not a concerning thing, so don't panic, but just more reassurance that getting erections in the morning and waking up with wet sheets can be normal. And then the final few things I want to talk about with penis development are going to be some things that you might see on the penis. So on the penis itself, especially as the penis grows and stretches, you might notice one thing called skin bridges, which are just little adhesions between the glands or the head of the penis and the shaft of the penis. Sometimes you'll see little inclusion cysts underneath those, and that's just going to be a collection of dead skin cells. And both of those are very common whether or not you've been circumcised, and they usually correct themselves as your penis grows. If they don't, and if you're through puberty, you still notice some skin bridges or inclusion cysts, talk to your doctor. The other thing to talk about is phimosis. So if you have a foreskin and the foreskin is unable to retract with the growth of the penis, then you also should talk to your doctor about this. And what I mean by retract, so you should be able to pull your foreskin down over the head of your penis so that you can clean under there, or so that erections aren't painful. Again, if the whole of your foreskin is too tight, that's called phimosis, and that means that you can't pull the foreskin down completely. Talk to your doctor. There's some things that we can do to help. And then lastly, inclusion cysts, which are the little white collections of dead skin cells that I talked about, different than pearly penile papules, which are little fluid sort of filled vesicles that can hang out around the glands of the penis or the head of the penis. Also very normal, nothing to panic about. All right, on to your questions. Okay, heads up, I included a lot of extra questions on this one because I have some amazing questions about like male body changes in puberty. So I think I've got 12 or 13 questions. 13. All right, get ready. Question number 1. Well, this one's kind of a joke. Is it possible to skip puberty and head straight into adulthood? Like one day you're a child and then you fell asleep and you just hit puberty and then completed it when you wake up as a full-grown adult. So is it possible to complete puberty in 8 hours or less? Unfortunately, no, it's not. There's no amount of medication or anything else that could make us go through puberty. It is a huge process, and realistically, there are things that are bigger than the things that are happening on the outside of our body. Specifically, a lot of brain changes, mental health, and relationship changes. A lot of things happen during puberty that really do take time, and it's more than just the stuff you're seeing on the outside. But if there were a way, I'm sure plenty of people would sign up for overnight puberty. Question number 2. Is it normal to get facial hair before reaching puberty? So this is an interesting question because it kind of comes back to why facial hair really kicks in during like your early 20s, is because the testosterone in your body has really reached its full potential. So yes, it's possible to have some facial hair. It's probably not your full-on like the coarser beard and mustache hair. It's possible, and I've certainly seen that younger males get darker upper lip hair that looks like a mustache, but I bet you're in store for darker, thicker facial hair when you get older. So if you were to have a full-on beard before you hit puberty, 1, that would be really rare, but 2, you need to talk to your doctor because that means that you're having some testosterone and androgen signaling that is abnormal. So a full-on beard, talk to your doctor. Anything less is probably normal. Question number 3. I have a tender, I didn't talk about this, super normal. I have a tender nipple and both of my breasts are swollen. I think it's gynecomastia. When I squeeze the nipple, I see a little clear discharge. I used to take gym supplements a couple of months back. I'm 19 years old. What's your opinion? I did not talk about gynecomastia as a normal part of puberty, and it is. So a little bit of breast tissue development, maybe a little like tissue under the nipple, either of one side or both sides in someone with male anatomy, super common. It's usually short-lived, so like it resolves after a year or 2. If it persists, definitely talk to a doctor. And one thing that they may go over with you is sometimes people who experience some weight loss can reduce that gynecomastia. A variety of things to consider here, but if you are in the middle of puberty, you notice a little breast tissue, super normal. This particular situation, you said gym supplements. I'm not sure what that would mean, but there are certainly some steroid supplements that can lead to gynecomastia. So if you were taking steroids, I'm glad you stopped, and you should see resolution of those, although if you don't, talk to your doctor. You mentioned squeezing a nipple, and it is common also because it's breast tissue. It's common to get a little fluid out, so don't panic about that. Question number 4. In your video on male puberty, can you talk about micropenis? Okay, so a lot of people are worried about penis size. And micropenis is a medical term that we use to talk about a small penis. And it's specifically for after puberty. So after puberty has completed, if your penis is smaller or shorter than 3 inches from base of the pubic bone to the tip of the penis, if it's smaller than 3 inches when erect, then that's technically considered a micropenis. If this is you, talk to your doctor. But a lot of people sort of throw that term around. It is a medical term, and we use it for very specifically a penis that is less than 3 inches when erect. Question number 5. If a boy started puberty at 17 and got his growth spurt at 18, what age will he stop growing? So this is a tough one. When you're born, you start growing, and you really continue through the end of puberty and maybe a little beyond. In this particular individual, it's tough to say for sure, but usually after the growth spurt, you're gonna have another couple years of growth, and you can expect maybe another inch or so after the growth spurt. So for this individual, tough to say for sure, but a couple years. It's impossible to say for sure. But look at your parents also. and that can help you figure out how tall you might end up being. Usually males tend to be closer to their dad's height, and females tend to be a little bit closer to their mom's height, but both parents pull up the height predictability. Question number 6. I'm a 12-year-old male. When I masturbate and orgasm, a bit of clear stuff comes out. Am I hitting puberty? I've also started to see some hairs, short hairs, about a half an inch around my penis, and it kind of has started to curl. Okay, so the clear stuff that comes out, it's tough to say. So like I mentioned earlier, sperm production is going to be a big part of toward the end of puberty. It's unlikely that you've hit that yet, but your pubic hair tells me that you have started puberty. So get ready for more changes. Question number 7. I'm 17 and I'm only just starting male puberty. My testicles have enlarged and I have some brown hairs in my groin, but that's really it. I've grown from 5'2" to 5'4" in the last 2 months. Well, that's a growth spurt. These things have indicated to me that I've started puberty, but I still look about 12 or 13, which worries me as I start university in the fall. Do you have any advice for me? So, 1, I talked about normal start of puberty, but it's generally just fine if someone starts puberty a little later, so don't panic. Your body will probably still go through some changes before school starts. And that was a monster growth spurt. Like 2 inches in 2 months. That's good. I bet you've got more coming. Tough to say for sure how tall you're going to be. Again, look at your parents. Talk to your parents about when they had puberty too, because that's usually a good indicator of when you would have it. But unfortunately, there's not a lot that we would do at this point from a medical standpoint since you started puberty. Unfortunately, you just have to give it a little bit more time. But you'll get there. It can feel kind of funny, but you know what? First year of university, everyone feels kind of funny. So don't worry about it. You'll get there. Question number 8. Is it okay to talk to my mom about puberty and specifically about my penis size? Is that a normal thing to do? Or do moms worry about that? Should I let her be in the room when the doctor checks down there? Not sure what to do. Okay. So first of all, it depends on your relationship with your mom, and if you're not comfortable talking with her about it, that's fine. And every parent's going to be a little bit different, but I think most parents would want to know if you have any concerns or questions. You could always have her in the room with the doctor if you want her there, and you can also ask her to leave if it makes you more comfortable. And then if it's a female doctor, you can always ask to have a male doctor if that makes you more comfortable. You know, there are a variety of things, but my point is that nothing is abnormal. It's okay to talk to your mom about these things, totally. And it's okay to feel uncomfortable about talking to her about these things. So if you want to say, hey mom, I've got some questions about puberty, is it okay if I go talk to the doctor? I bet she'd say cool. Yeah. But everyone's going to be a little bit different, but just know that whatever you choose to do or who you choose to talk to about it, it's completely fine. Question number 9. I've been a wrestler since I was 4. I'm 14 and a half now. 10 and a half years. I've been cutting weight or crash dieting for wrestling for a long time. And I have little to no signs of puberty. My dad says that just to wait, but I wanted to seek someone's opinion who knows more about the subject. Should I see a doctor or just wait? Okay, well, this is tough because 1, we don't love the crash dieting thing. I understand the pressure for wrestling. You're probably pretty competitive, but that's a separate topic, but I don't love it. Is it contributing to your delayed puberty? It's possible. If this is you, talk to your doctor. Question number 10. How far back should the foreskin be able to be retracted while erect after puberty? How long should the frenulum be? Ways to stretch the frenulum? Penis head bends down if foreskin pulled back a lot due to frenulum. Okay, so after puberty, you should be able to retract your foreskin all the way to the base. And you probably have quite a bit of extra foreskin when you retract it, especially if it's flaccid, but so you should be able to pull it back. There can be a very tight frenulum. Frenulum breve is when it's like super tight and like erections are painful. Frenulum is that little connection of the glands to the shaft. Otherwise, it should be a nice ring around the head, but the frenulum is sort of where there's a little bridge. That can be too tight. And if you have painful erections, if the erection curves more than you're comfortable with, talk to your doctor. But to answer your question specifically, you should be able to retract your foreskin all the way down. And it shouldn't be painful. Question number 11. I'm 14 and my only sign of puberty is a little bit of pubic hair, but I haven't noticed any growth in my penis or testicles. Is it normal to have pubes before penis growth? It's possible. So the thing about puberty is that we have these timelines, but they're actually, for both male and female anatomy, run by a couple of different hormones. And so the hormone that runs pubic hair and acne and body odor is actually a different hormone than the one that directs like penis and testicle growth or periods and boob growth. So it is possible to have pubic hair before the other stuff. Again, like I've been saying, testicle growth can be really difficult to assess because it's small at first. So you probably can't notice the changes too much. But yes, to answer your question, it is possible to have pubic hair before the testicle growth. But you want to make sure you're still within that normal range of puberty. And I doubt you would be writing me if you're like under 8. But any pubic hair that's too early, talk to your doctor. Question 12. I love this one. Do we have an Adam's apple before puberty, and is it just invisible? Because how are we able to swallow or eat food if we don't have an Adam's apple? Okay, so the Adam's apple is this growth in the neck, and then women have it too, but those with male anatomy, it's more pronounced because it's your voice box. And for males, most males have deeper voices, and this is actually a function of testosterone growth. And with your voice drop, the Adam's apple gets bigger so that the sound can resonate more in your throat. And so there is a bit of an Adam's apple. It has nothing to do with swallowing. It's all about your voice box. So that's why you get this larger lump in your neck with puberty and after puberty and with your voice drop. I love this question. But women have them, men have them, just they're usually a lot bigger. And that's because their voices are deeper. Or their voices are deeper because they have a larger Adam's apple. And then question number 13. This is embarrassing to ask, but when will I stop having wet dreams? I've finished puberty, but I don't feel like I have because I still feel like a 13-year-old boy who gets wet dreams too often. So wet dreams can keep going. It's not necessarily just puberty. It's just that you get aroused and orgasm during sleep. You could try wearing tighter briefs or boxer briefs when you sleep to see if that keeps the penis closer to the body, therefore less friction and less potential for a wet dream. But there's nothing wrong with you. I understand it's probably just a little sticky to wake up to, but there's nothing wrong with you. It's not just a puberty thing. So thanks for watching this episode of 22 and 23, and stay tuned for more.